unresponsive. You were supposed to meet him for breakfast. Came out that you were supposed to meet an hour ago. You called his phone. You just came to his house, have a key, found him unresponsive in bed. Okay. You're going to be completely unresponsive. It'll be easy for me to make up history. Okay. Previously healthy. We'll make him a diabetic. Other than that. Okay. So he's.
Type 1.
Pardon? Type 1. Takes insulin. No other conditions. Away we go. Dispatched for a 46-year-old male patient, unresponsive. Arrive on scene. Met at the scene by, hello, how are you? I'm Matthew, I'm paramedic. What's going on?
My brother Morgan there. I was supposed to meet him an hour ago for breakfast.
Yeah.
And he didn't show up, so I came over to his house and I found him unresponsive on his bed.
Okay. So we make our way. We follow your names.
Jeff.
Oh, okay, Jeff. And how do you know Morgan?
Just my brother.
Oh, okay. So we follow Jeff down into bedroom. We find Morgan laying flat in the bed. As we approach him, we see that he doesn't respond to us at all, and we're hearing breathing. Let's say he's grunting a bit. He's going as we approach. So I can see that he's obviously breathing as I approach, but he's not interacting. So we come up to the head. Come on up here, partner. We'll come have a sit. Morgan. No response to verbal. No response to pain. Just going to quickly check for a pulse. I've got a bounding regular pulse. Just going to have a look at his airway. Open. Okay, I can't really see his airway, but we'll just suction him out. So we turn our suction on, turn it up, and we suction him out. He doesn't gag or respond to that at all. We're able to get that in. Do you want to get an OPA for us?
Yeah.
I think you'll take one. Hidden fall, no recent falls or anything like that?
No, nothing at all.
Okay.
He was healthy before this.
Okay, so no recent trauma. So we'll just get an OPA and try an OPA in him. Size appropriately. Respiratory rate and depth. Okay, so OPA's in. Rate and depth, we'll say that he's breathing breath per second. He's got big tidal volume grunting. So I'm just going to do a quick physical assessment. Do you want to get a set of vitals? Let's start with the blood glucose and then get his blood pressure and the SpO2. I'll throw the SpO2 on him right here. So. Pen lights? Oh, you do. Look, brother, thank you for your pen light. Okay, I'm just going to shine a light in his eyes, see if what I can see. Okay, pupils are responsive to light, 4 millimeters. Doesn't seem to have any evidence of any trauma. Mucosa is moist. He's still breathing well. No JVD. Trachea is midline. Feel chest rise and fall. Thank you, brother, for bringing the stethoscope. You can just throw that on. Sat is 99%. He's got a pulse rate of 61. Deep breath. You don't obey commands. He's still grunting. Listen, inhalation and exhalation. Do a breath for a second for me, if you don't mind. Okay. So notice he's incontinent. No evidence of any trauma anywhere in his legs. His blood glucose comes back at 6.8. Okay, so does he have any allergies to any medications?
No, not that I know of.
Has he ever had episodes like this before?
Maybe once or twice.
Do you want to grab the stretcher, bring the stretcher over, and we'll just lift him up and move him over ourselves.
We would have had an episode like this once or twice, but usually only when his diabetes is acted out.
Okay. When was the last time that his diabetes acted out?
It's been years.
Okay, I'm just going to take another blood sugar in the other hand just in case something weird happened, because he does seem low right now. And we can think about other things that could be happening. Let's say his blood pressure comes back as hypertensive. 198 on the 104. Pulse rate is still at the low 60s and SATI 99% on room air. So allergies, what medications? Anything? Just the insulin? And no other medications?
I probably take some Tylenol every once in a while.
No other diagnosed conditions at all?
Not that I know of, no.
And problems with seizures, never had strokes,
No.
migraines,
No.
history of psychiatric conditions at all?
No.
No problems with his heart?
No.
No breathing?
It's all fine.
All fine. Just the diabetes. Okay, we're just going to give him sit up. Have you sat a patient up this way before?
No.
Okay, we'll just, so what I can do with him is I'm just going to step over him here carefully. I'm going to pull him ahead, and you're going to come behind him, give him a big hug with his arms. You remember when we did that with, over on the other,
yep.
with Dan? Okay, ready? Okay, just going to lift him up, you come behind, give him a big hug. No, you're going to hold his arms. Remember we were doing this with the other day. We're good there?
Yep.
So you're going to get close to him, get really close. I'm going to scoop his legs, and I'm going to lower this down just a smidge. Okay. So you're going to call on 3, and I'll lock my brakes here so we don't wheel away. Oh, we have another one here. Okay. Wow, there's a trip all over it. Okay.
So on 3?
Yep.
1, 2, 3.
Okay, and just set him in. Perfect. Let's scoot him over a bit. Okay. Bring him on down. How's his breathing? Can we move him? Just gonna pull him down a bit. Okay. We'll sit him up. So let's, because he's unresponsive, let's just roll him a bit onto his side, okay? Okay. And we'll just going to tip him over onto his side and show us, yep, we're going to roll him towards us. We're just going to put his leg like that. Okay. So one leg like that. Okay, let's seatbelt him in. So as we're getting him here, over to the stretcher, as we're about to seatbelt him in, we'll say that he starts to seize, okay? So he starts to seize all over, shaking leg, everything else, okay? So he's shaking, so we'll note our time of the seizure. He's on the stretcher, so he's well protected. And I'm just going to put my SpO2. Sometimes it'll pick up, sometimes not. Usually seizures will last less than a minute, but not always. So we'll say he's still seizing. Okay, and he's going to stop seizing for us at this point. Okay, we're just going to throw this back on. I'm going to reassess his airway. Open up his airway. Okay, just open up his airway. See, let's just suction him out here. Suction. Get some spits. Okay. Okay, let's note that he's now not breathing, let's say, a breath every 10 seconds. So we're doing 6 per minute. I'm just going to move him onto his back now, of course. So we just slide him onto his back, and I'm going to try ventilating him. Okay? Okay. So I'll grab my bag ball mask if you want to keep buckling him in. Are you going to come with us, Jeff?
Oh, yeah.
To the hospital?
Yeah.
Where's your oxygen tubing for you?
Might be in the front couch or something.
That'll do.
Oh,
So we'll hook up our oxygen, high flow oxygen, to our bag. Then we'll set up the front. So we'll say we'll put the bag on him, ready to breathe. Can you get his shoulder straps on, please, and his chest strap? So, yeah, over top of his arms. So we'll say breath is going in well. And I'd be using proper EC technique, but I'm not going to put this on your face. Tighten the dorsal strap first, right here. Snug her up. And then this one can just get like so. Okay, let's grab our red bag and our sectioning. We're going to lift him up and we're going to move him over to the truck. Okay. What's our sats right now?
Sorry, 99%.
Okay. Let's lift him up. I'm just going to set the bag beside his head. His OPA is still in place, and we're going to lift him right up. Ready? On 3. 1, 2, 3. Okay, and let's wheel him over, and we'll get him in the truck. Okay, let's go to the truck. You're going to have to move the camera. And the scoop stretcher. I wish I had enough parks so close to these shrubs.
I'll let him trim those shrubs from his yard for you guys.
Okay, in the truck we go. Have you done this in the back? Just a second. We've got extra stethoscopes here just piled on the bench. And an iPad.
But he didn't have one with him earlier.
Okay.
Left them all in the truck.
Just going to give him another breath. Okay. So lift up, pull back, and here we go. You're just in a little too far. So we can go, sir. We'll go code 1 off the QEH. I'm going to reassess level of consciousness. Can you hear me? Hear me at all? What's respiratory rate? Let's say respiratory rate's coming up a bit. He's now breathing a breath every 6 seconds. Okay, I'm just going to put him on some high flow oxygen and see how he does with that. If you want to grab the red bag and just throw it in on this side. And I'm just going to hit another NIBP. And I'll remember here, I'm going to set that to go off every 5 minutes. So code 1, how far away are we from the hospital? How long have we been recording there, sir?
12 minutes, 40 seconds.
12 minutes, so we're 8 minutes away from the hospital. Non-rebreather. This is clean. It's brand new out of a package. Okay. So we'll put this on. This would be inflated fully. We're up to 10 liters of oxygen. Okay, so can you hear me, Morgan? Still no response. So I'm going to start an IV on him. To start off, we're going to blood pressure, SpO2 is 99%. He's got adequate tidal volume right now. He's breathing 10, which is just on the slow side, but we have adequate saturation, so we'll watch that for the time being. I'd like to have CO2, but I don't right now, so let's just say that we have adequate minute volume. Blood pressure still coming back is hypertensive, 206 on 102. We're just going to get an IV. So I got an 18 out of 20 out. The tourniquet on his arm. Your bag needs to be desperately cleaned. You don't have any tape.
There should be tape.
There should be tape.
Pardon?
And where the IV bag was.
In where?
Where the IV bag was.
Oh. So prime yourself an IV bag. Hang it up on the wall. We got some nice veins here. And we're going to start, if I can ever uncoil this. veins there we're going to be able to get. Just tear some tape off so that I can... When you leave tape, it's nice if you leave the end folded so it's easy to be found. Makes it a lot easier. One right here. Gonna reassess, just looking at him. Morgan! Still unresponsive. Still adequate breathing. Good SATs. Blood pressure still hypertensive. Heart rate still 60, in low 60s. I'm going to take an IV. We'll poke him with an IV and say that we'll put this in. I'm just not going to poke him for right now. So we'll say our IV's in, tape, and see that it's running. See that it's running well. Okay. Maybe the composites are getting a little bit on the old side. Make a little loop so it doesn't get pulled off. Okay, so we've done our initial assessment, ABC, we did a physical assessment, he had a seizure, we're about 5 minutes away from the hospital. QEH, do you copy?
Yep.
QEH worker, EMS, Unit 57, currently transporting a 42-year-old male patient who was found by his brother unresponsive. He has had 2 seizures one seizure. I'm sorry, I've done this scenario a few times. He's had 1 seizure, and which his respiratory rate slowed. Currently, his respiratory rate is 10 per minute. He's got a SAT of 99%. We have him high flow oxygen, pulse rate of 64, and a blood pressure of 204 on 102. We should be at your facility in about 3 minutes. Do you copy?
Yep.
Okay. So we've done. So I'm going to hit another blood pressure here. Take note of another. I'll just set my monitor now that I have a moment to set my monitor to go every 5 minutes to schedule a BP. And we'll start another one right now. And his SpO2 is good, and he's still breathing. We have an IV in place. So now I can start thinking. We haven't given him any medications, but let's just talk out loud. I can think through my differentials out loud. So I'm thinking possible AEIOU TIPS is a great acronym. So alcohol. Jeff, do you know if he has any history of alcohol abuse? Is he a heavy drinker?
No.
No? Okay. Jeff's riding up front.
Yeah.
That's very convenient. The voice is coming from back there, but he's up there. Overdose. Any chance he uses any recreational drugs at all?
No, he's really careful with his diabetes, not to do any of that.
You don't think he'd do that?
No.
No history of any kind of risk-taking behaviors in his past?
No.
Okay. So overdose. No history of seizures before?
Nope. Not that I know of, at least.
Okay. Has he been feeling well? Have you talked to him recently?
I said he was feeling healthy the last time I talked to him.
Okay, so it doesn't seem to be infection. He could have an infection in his brain, have something like meningitis. We'd like to think if he had any history that maybe we would want to think about personal protective equipment. No history of kidney problems for uremia, no renal failure on dialysis, nothing like that. Hasn't had any recent falls, got hit in the head or anything in the last week that you know of?
Not that he's told me about, but I haven't talked to him for the past week.
Okay, you were just meeting him for breakfast? We've talked about psychiatric history, and we talked about insulin. He is a diabetic. Took another blood glucose, came back the same, so we're going to assume that it's not his sugars. Any history of cardiovascular disease or stroke in your family at young ages?
Not quite young ages, I think 50s.
Okay, well he's getting closer to that. Okay, so we arrived to the hospital. We'll pull him out. Okay, Jeff, or who was Jeff? Wasn't part. Somebody want to grab the end of the stretcher and we'll pull him out and we'll give a report to the hospital. Okay, I'm just gonna disconnect him here from the oxygen for a minute while we pull him out. OPA is still in. Just gonna throw this in the head. Yes, of course. Of course. Okay. Let's turn that IV off. as I threw it on him. Place gently on the patient if the IV pole's not up. You just want to squeeze that handle. The right handle. There you go. Okay, let go of the right handle. Yeah, and then click. There you go. We weren't quite up high enough, so we had a little bump there. Hi, Dr. Jeff. How are you doing?
I'm
You're
good.
looking an awfully lot like the brother of this family. We currently are we found your brother's name is
Morgan.
Morgan, who's a 42-year-old male patient who was found unresponsive by his brother. His brother was supposed to meet him for breakfast. We found him unresponsive. We suctioned his airway, had a little bit of secretions in his airway. He accepted an OPA. At that time, he had an adequate tidal volume and a strong radial pulse, but unresponsive to painful stimuli. On physical assessment, nothing abnormal, air entry clear ×4. He is hypertensive with a blood pressure, last blood pressure was 206 on 100 diastolic. He's SATI 99% at present and has a heart rate of 64. The last blood glucose was 6.8. He did, just as we were leaving the home, maybe 10 minutes ago, had one seizure, which his respiratory slowed to about 6 per minute. We decided to bag valve mask him. He's since brought his respiratory rate up. Was at 10, and he seems a little bit faster now, in fact, and been holding his SpO2 well. We have an 18 gauge in his left AC, and we can't seem to figure out any specific reason why he has an altered level of consciousness. He does have a history of diabetes, but we've taken his blood glucose twice and haven't found anything else. Okay, we'll transfer over. We're done.